Hey guys, it's Dave coming at you today with some information about sleep apnea. It's one of the most undiagnosed conditions out there. Basically, because if you live alone, you really won't know that you have it. If you happen to have a significant other, they may sleep through you actually having the issue, or they may have it themselves. It's not just about loud snoring. Yes, that can be a main part of it. However, what really happens is throughout the night, you're actually stopping breathing several hundred times throughout the night. You may stop for a few seconds, you may stop for a couple of minutes before your body actually kicks in, goes, hey, I'm not breathing, at which point you will gasp, snort, or snore to catch your breath and go again. This basically breaks up the cycle of sleep and wake, so you're not getting good quality sleep, which makes you more prone to be sleeping in the day when you need to be paying attention to business, which can lead to things such as losing your job, having a car wreck, and some long-term health consequences as well. Most of the time, it occurs in males instead of females. However, the majority of the people that do get it are over the age of 40, and men and women can both get it. One of the things that you will notice, like I said, is the daytime sleepiness, where you may think that you're getting 8-9 hours of sleep, but really you wake up and you're just as tired as when you went to bed. Your significant other or people in the house will notice that you do snore loudly. They may also notice that you do interrupt your sleep by not breathing, and it can be scary at times. But just because you snore does not mean you have sleep apnea. That is one of the potential things that do occur, but you don't have sleep apnea if you snore. Children can also get it, and infants as well, so you want to be aware of that. Like I said, it mainly occurs after the age of 40, but it is something that can be seen in anybody. There are 3 types. Obstructive sleep apnea is the main one. That's the one that is seen most often across the board. Central is also seen, and then mixed, where you have a combination of the two, is the last one you can see. With the obstructive sleep apnea, snoring is definitely the most telltale sign of it. Most of the people that have obstructive sleep apnea, you will definitely see the snoring involved, because what happens is tissues in the upper airway partially or completely will collapse during the night and will block off that airway, and so you will stop breathing, and in order to start breathing again, you'll do the snort, snore, gasp that will then cause you to start breathing again. Risk factors that occur with obstructive sleep apnea. Mainly the biggest one is obesity, but also involved in that, if you have nasal polyps or enlarged adenoids, enlarged tonsils, or even a big tongue, you can be prone to have sleep apnea. Several neurogenic muscle conditions can also make you prone to that, because your muscles are not, muscle tone is impaired. So that can cause that collapse to happen. If you have hypothyroidism, so if you're on a drug like Synthroid or levothyroxine, that may make you more prone to it as well. As far as another type, the central sleep apnea, only about 10% of the people actually have that. And that is where the respiratory drive is actually impaired. And it causes the brain to fail to send a signal to the respiratory muscles saying, hey, take a breath. Unlike obstructive sleep apnea, patients will be aware that, hey, I didn't sleep very well last night, and I woke up several times throughout the night. There's less daytime drowsiness with central sleep apnea. While obstructive sleep apnea, you're not aware that you woke up several times during the night because you couldn't breathe. With central, you're more aware of it. Some of the risk factors with central sleep apnea is COPD or emphysema or asthma, heart disease, and neuromuscular diseases. So if you have MS or muscular dystrophy, something like that, you're going to be more prone to it. And like I said, the final one is mixed, and that really occurs mainly in infants and children. So that's what you need to be aware of with that. Other factors that'll make you prone to sleep apnea. If you have several family members that have sleep apnea, where there's a family history, you will be at a greater risk for that. If you have a large neck or a recessed chin, you're at greater risk for that. Obesity, like I said, really can cause a problem with that and make you more prone to it. The other thing, if you have Mexican heritage, African American heritage, or Pacific Islander heritage, you're going to be more prone to it. If you have a major disease such as diabetes, gastroesophageal reflux disease, congestive heart failure, any upper respiratory issues at all, that's going to make you more prone to it. Alcohol use will make you more prone to it. Any medication that will depress your central nervous system, so a lot of antidepressants, sedative hypnotics that help you sleep, narcotics, antihistamines like loratadine, fexofenadine, or diphenhydramine, those all can make you more prone to having sleep apnea. The consequences of it can be headaches, having memory issues during the day. It's not because of dementia, it's because of a lack of sleep. Daytime sleepiness, which can cause the things that I said, like loss of job, mistakes at work, car accidents. Those can all be more pronounced due to sleep apnea. High blood pressure, heart disease, stroke, issues like that can all be stemmed from not getting enough sleep related back to sleep apnea. Your diagnosis from this, if you're noticing your daytime sleepiness, you notice, oh, I'm waking up because I'm gasping for air, you want to make an appointment with your doctor because you do need to have a sleep study to actually be diagnosed with sleep apnea. They can order you one of those. Most insurances will pay for that. Now, what can you do if you're diagnosed with that? Well, the first thing you can do, there are some lifestyle changes you can make. Number one, get some exercise in. It will help you lose weight. It will also make you more tired when you go to sleep that you sleep. Avoid alcohol and those drugs that I mentioned that affect your central nervous system, because again, that's going to make you more prone to sleep apnea. The easy one that you can do is change your sleep positions. If you normally lay on your back in a supine position, change and lay on your side. That can decrease your sleep apnea during the night by at least as much as 2 times, just by changing positions. Something else that's hard to do, I know it's very difficult for me. Use your bedroom for sleep. So don't watch TV in your bedroom. Turn off your phone, get off your computer, get off your tablet at night right before you go to bed. That gives your mind time to cool off, to shut down, so you're not awake going to sleep. You hopefully will fall asleep faster and stay asleep better by doing that. As far as medications, things that you might be able to try, there really haven't been many medications that have actually shown results that they've helped. However, the better you can control your disease state that you may have, like COPD, asthma, hypothyroidism, if you have hypertension or congestive heart failure, if you have heart disease, the medications that you're taking for these disease states, if you can get on those and stay on those, it can help your sleep apnea by having better control of those disease states. The one exception to the rule is acetazolamide. It's an old drug, but it has shown to help with the central sleep apnea by causing stimulation to help your brain say, hey, I need to breathe. And acetazolamide has helped with that. Other than that, you can use certain devices. The CPAP machine is out there. It can help decrease sleep apnea and has had a lot of results in doing that. It's a cheaper alternative out there. You do have to remember to keep your nose, your mouth, and your eyes moist. So something good like an air gel or an aqua gel is what I recommend, is a very good thing as far as your nose. As far as your mouth, if you can have some water before you go to bed, have some water when you wake up, that definitely will help out, and stay hydrated. Artificial tears will help with your eyes. Very important to remember to clean your sleep apnea, or excuse me, your CPAP mask on a regular basis so you don't get any upper respiratory infections. That is key. The other thing that's out there for people that just can't handle a CPAP because of the dryness is a BiPAP machine. However, remember, you may struggle to get that paid for by insurance. They are quite a bit more expensive than the other. But that is another option when you fail the CPAP machine. Something else that you can try is mandibular repositioning, basically mouth guards that you can put to help change the way that your mandible sits when you sleep. It's not going to help everybody, but it definitely is worth a shot. A lot of the associations recommend the CPAP first before you try that. However, it is a cheaper alternative that you can definitely look at. As far as surgical interventions, that's the last step that you can look at. Really, the results are very mixed. For long term, a lot of them don't do you much good for what you have to go through. And for people that have things like congestive heart failure, surgery may not be the best option for you. Hopefully this has given you some information. Absolutely, if you have yourself or a loved one that you're noticing those symptoms that I talked about, get into your provider, get it checked out so you can get some help with sleep apnea so you don't get long-term health problems from not treating the apnea.